All right, so if you're an MBBS student in India, listen up. The National Health Mission, this isn't just another chapter you have to memorize for an exam. No. This is about understanding the very system you're about to become a part of. This mission is what shapes how healthcare gets to millions of people, from our biggest cities to the most remote villages. So, let's really dive in and figure out how this massive undertaking actually works.
Here's what we're going to cover. First, we'll take a step back and look at the health crisis India was facing around the year 2000. Then, we'll see how the National Health Mission, or NHM, was born out of that crisis. After that, we'll break down its core strategies, check out its report card over the last decade with some hard data, and finally, we'll look at what's next, the challenges and opportunities that you'll be facing as new doctors.
Okay, so let's set the scene. We're rewinding back to the turn of the century. India was at a crossroads, you know? The public health situation was, well, it was in a state that needed a huge, coordinated intervention.
The numbers were pretty grim back then. We had really high rates of maternal and infant deaths, and that was just the start of it. If you look at policies from that time, like the National Population Policy of 2000, they spell it out. There was a massive gap in basic healthcare infrastructure, a serious shortage of trained medical staff, and even a lack of essential supplies. There was this huge, urgent divide between the healthcare people needed and what they could actually get.
So this was the big question, right? How on earth does a country tackle a health crisis this big? It wasn't just about building a few more hospitals. It was about creating an entire ecosystem of care that was affordable, easy to get to, and actually worked for more than 1 billion people. The answer had to be a total rethink of our public health strategy.
And that answer, that paradigm shift, was the National Health Mission. This wasn't just another government scheme. Think of it more like a massive architectural blueprint designed to rebuild India's public health system right from the foundation.
At its heart, the NHM has a super clear goal: make sure every single citizen has access to decent, affordable, and quality healthcare. But here's the key part. It's not just about everyone in general. It puts a special focus on the people who've often been left behind, folks in rural areas, and especially women and children, because they're the ones who often face the worst health outcomes.
Now, this whole thing didn't just pop up out of nowhere. It evolved. It all started back in 2005 with a laser focus on rural India. That was the National Rural Health Mission, the NRHM. But by 2013, it became obvious that our cities had their own unique health problems. So the National Urban Health Mission, or NUHM, was launched. And the genius move was bringing both of them together under one big umbrella, the National Health Mission. But it didn't stop there. In 2018, Ayushman Bharat came along, working with the NHM to add a safety net for more serious hospital care.
So, how does this huge mission actually get things done on the ground? Well, it's built on a few key pillars, with each one tackling a different piece of the public health puzzle. Let's break them down.
The NHM is seriously comprehensive. I mean, it covers the whole shebang. You've got the RMNCH+A strategy, which is basically a fancy way of saying it looks after health through the entire life cycle, from reproductive and maternal health all the way to adolescent health. It also runs all the big disease control programs for things like TB, malaria, and leprosy. A massive part of its job is just making the whole system stronger, building clinics, training people like you, and making sure supplies get where they need to go. And now, it's also taking on the rising tide of non-communicable diseases like diabetes and heart disease.
To see how this all works in the real world, let's just take one famous scheme, the Janani Suraksha Yojana, or JSY. It all starts with the ASHA worker. You'll be working closely with them in your rural postings. She's the link to the community. She finds pregnant women, makes sure they get their checkups, and, this is crucial, encourages and helps them to deliver their babies in a proper health facility instead of at home. And to help with the cost, the scheme gives them a direct cash payment. It's a brilliant example of the NHM strategy: community outreach, medical care, and financial help all working together.
Okay, so that all sounds good on paper, but has it actually made a difference? Let's dig into the data from the last decade and see what kind of impact we're talking about.
First up, let's talk about access to care. Under the NHM, we've seen over 1,72,000 Ayushman Arogya Mandirs get up and running. You might know them by their old name, Health and Wellness Centers. These are the front lines of healthcare. And are people using them? Oh yeah. Get this. By March 2024, they'd seen over 258 crore patient visits. That's crore with a C. That's not just a number. It's a revolution in healthcare access, right at the grassroots level.
And what's happening inside these centers? This is where you see a huge shift toward preventive medicine. Just look at these screening numbers. Over 63 crore screenings for hypertension, 55 crore for diabetes, 37 crore for oral cancer. This is what proactive public health looks like, finding and managing these diseases in the community long before they turn into emergencies. That's a game changer that eases the burden on the entire system, especially the big hospitals, where you'll be working.
You can see the impact in specific programs too. Take the fight against leprosy. The data here tells a really powerful story. Yeah, the prevalence rate is down, which is great, but look at that second row. The rate of severe grade 2 disability, the really bad stuff, has been cut by more than half. That means far fewer people are suffering the worst outcomes of the disease. And the percentage of new cases in children, that's dropped dramatically. This is real, measurable progress against a disease that's been around forever.
So, the progress has been incredible, but the job is far from done. As India's health needs change, new challenges pop up. And honestly, this is where you, the next generation of doctors, really enter the story.
Look, even with all these new primary care centers, we still have a major challenge: a shortage of specialists, especially in rural areas. We also need to keep strengthening our tertiary care hospitals, the places many of you will be doing your postgrad training. The end goal is to make sure that the quality of care you get doesn't depend on your zip code. Closing that gap, that's the next big task for the NHM.
Which brings us to this final question for you. The National Health Mission isn't just some policy written down in a file. It's a living, breathing system that's always evolving. As you finish your studies and step into this system, you're not just going to be a doctor practicing medicine. You are going to be an active part of writing the next chapter of public health in India. So, the question is, what role are you going to play?